Hello, and welcome to Diagnosing the Barriers, the Right to Health in Israel and the OPT, a podcast from Physicians for Human Rights Israel, or PHRI. I'm your host, Natalie Foster. PHRI is an Israeli nonprofit organization that promotes the right to health for all people living in Israel and the Occupied Palestinian Territory, or OPT, through the direct provision of medical care and policy change efforts. In this episode, we will be talking about what is happening at the Teiman military base in Israel's Negev desert, which has doubled as a detention center for Palestinians from Gaza since the early days of the current war in Gaza. Recently, reports have come out regarding the abuse and ill treatment of detainees held there, as well as violations of medical ethics that have occurred at the field hospital established on-site for Gazan detainees. I'll be speaking in this episode with Oneg Ben-Dror, a projects coordinator in PHRI's Prisoners and Detainees Department, to dive into the reported abuse in Teiman and explore the violations of medical ethics occurring there. Oneg, thank you for joining me.
Thank you for having me.
So, in a previous episode, we covered some of the overall state of detention facilities in Israel and specifically the worsening conditions for Palestinian prisoners and detainees since October. And we heard from Naji Abbas, director of the Prisoners and Detainees Department, about the number of incarcerated Palestinians, particularly Gazans, who have been held in extremely difficult conditions in prisons and these makeshift detention centers across the country. So, Oneg, I think to start, let's take a little bit of a higher level. And can you talk a little bit about who is being held at these detention facilities?
Sure. Since the start of the current war, and especially since Israel's ground invasion of the Gaza Strip, Israel arrested thousands of people from Gaza, including minors, women, and elderly, and dozens of healthcare workers. We know of people aged from 6 to 82, and some were taken from protected places, shelters such as schools and hospitals.
So they're taken from sort of all over Gaza, including these protected spaces. And then where are they being held when they're taken?
Gazan detainees are held in makeshift centers in the Gaza Strip, in military bases within Israel, and in Israel prison service. And all efforts to locate them or obtain information regarding their well-being and whereabouts have proven unsuccessful.
And so one of these is Teiman, which some are calling Israel's Guantanamo Bay, that is a military base and has been converted to this detention facility for these Gazan detainees. So what are some of the conditions, particularly at Teiman?
Detention, which is one of the central ad hoc detention facility where Gazan detainees are being held, is in a military base in the south, 31 kilometers from Gaza. According to official directives from the Israeli military and health ministry and testimonies, Gazan detainees are being held there in an open-air pens and kept blindfolded and handcuffed at all times, even when they receive medical care. Reports indicate that these restraints have led to severe injuries in some cases, forcing medical staff to carry out limb amputations. The detainees there are forbidden from moving or speaking, otherwise they face severe punishment. And according to all testimonies from people who have been released, these detainees regularly endure severe violence, leading to cases of broken bones, internal bleeding, and even death. In this facility, a field hospital was established following the refusal of civilian hospitals to admit Gazan patients. And we have a base to suggest that breaches of medical ethics and professional standards, which may constitute to inhuman treatment and torture.
And so who's receiving care at this field hospital? Is it just detainees who are being held in the detention center? And then what's happening there for detainees who are treated?
So what we know is that this field hospital is located a few meters away from these open-air pens. It's basically a tent, a big tent. People who are presented there, they can hear the screams coming from the pens. So we know that detainees being held in this military base, they receive some care there. Most of the care with a medical team, which often doesn't have the expertise and qualifications, and they to carry out the procedures, even complicated procedures. And we know that consent is very rarely being obtained. People receive medical care, as I said before, while they are shackled to the bed, 4 legs. A testimony said that people were held with diapers there and were fed with straws. We heard that painkillers, even though they carry complicated procedures, the max that they can get is a paracetamol. And interns describe this place as kind of heaven for practice because they can do stuff and that they are not trained to. The directives from the health minister that I mentioned before talked about the healthcare workers who are working there. They are reservists, and they are not allowed to give their names. They can sign only. They are not allowed also to sign with their stamp. And we think that it is also to protect them from persecutions, future persecutions. Sometimes detainees in hard conditions are being transferred also to civilian hospitals, even though civilian hospitals repeatedly refuse to admit patients. And when they do, often we encounter medical staff who either refuse to treat them and then they need to be replaced, or also medical care besides the minimum is considered a privilege. So even giving also painkillers is considered a privilege. Some medical staff justified also the care only to support interrogators. And we also heard from medical staff at the hospitals about the substandard of care. So people are treating in a neglected room without the proper equipment. They are being sent on early stages, even though many Gazan detainees are being brought there with severe injuries, including gunshot wounds. But often they are being treated and then sent back to the military base as soon as possible, even when it risks their life.
Just a quick question. So in the prison system, I know that the IPS, the Israeli Prison Service, oversees the medical care for prisoners. So who is overseeing sort of the medical care in this field hospital? Who is supposed to be in charge of that?
That's a great question. Often when reporters are asking the health ministry about the field hospital, they refer to the Israeli army, but we know that even in the directives of the health minister, they note that the physicians at the field hospital, they are not part of the medical unit in the army. They are reservists, so it's unclear who supervises them.
So it's all sort of a little under the table in a way.
Yeah, and I guess no one wants to take responsibility on what is happening there.
So leading into a little bit about what's happening there, you started to sort of provide an overview of some of the things that have come out of conditions in the situation. And in April, PHRI had published a report based on information from whistleblowers working at the field hospital, as well as other sources. So can you describe a little bit more about what they shared about the overall conditions of the detention facility and the field hospital, and have other whistleblowers come out with additional information that has corroborated and sort of added to what's happening there?
Basically, with the help of whistleblowers and other sources, we got the picture that I mentioned before about the field hospital being in a tent few meters away from the pens, the medical. And we knew, we got the directives. We saw the directives from the health minister.
Okay.
And for instance, in the directive, it says that consent should be obtained when it's possible, something like that. And we understood from various testimonies that consent is often not being obtained, as we suspected. People are going through procedures without knowing what is happening to them, you know.
And so these are directives of how care should be provided, essentially, for these detainees.
Yeah. And in the directives, it says that the patients will be handcuffed and blindfolded the whole time.
CNN and other media outlets have also published articles detailing these conditions. Some even included photographs that had been taken by whistleblowers. Can you talk a little bit to maybe what the response has been to sort of this wider public attention, if any?
We still don't know it's hard to know the effect of it. I think it got big covered also in Hebrew media. But I think, one of the first steps in tackling violations of human rights is exposing them. So that this coverage is helping to do that. We hope there will be a continuous discussion about that until those violations will stop. We are calling for the closure of this detention facility, to stop torture, to stop the arbitrary detentions and the enforced disappearance of Palestinians.
What has PHRI done, and sort of what are some of the next steps for addressing this situation, not only at Stay Teiman, but also I think broader in terms of the detainees from Gaza?
Mm-hmm. So maybe it is important to know that Israel authorities have constantly declined to disclose information on the whereabouts and conditions of the individuals to their families and legal representatives, also organizations. We conclude that it's a forced disappearance of Palestinians that qualifies as a crime against humanity, according to the Rome Convention. Also, there is no official information regarding the number of Gazans who died under Israeli custody. We sent a Freedom of Information request to the Israeli army regarding the number of Gazan detainees who died. And we didn't receive an answer until this day. And we appealed to court regarding that. At the beginning of May, it was reported by Le Monde that at least 40 Gazan detainees have died under the custody of the Israeli army, but still it's not an official number. We know recently it was published that one of the Gazan detainees who died is Dr. Adnan El-Bursh, who had been the director of the orthopedic department at El Shifa Hospital in Gaza. His body is still being held by Israel, like the bodies of many others who were killed while in Israeli custody. So besides sending freedom of information request, appeals to the Israeli court, which usually reject our appeals. We also turn to, we work on international advocacy, working with, hoping that the international community will also be involved. And because we believe that the situation demands that there will be immediate intervention from the international community.
And so leading into my last question, what's the bottom line to end, I guess, this situation?
So we call for the closure of this detention facility, and to stop torture, to end the enforced disappearance of Palestinians. And we believe that for that, international intervention is necessary.
Thank you, Onig, for speaking with me about this critical issue. I think building on our previous episode on the worsening conditions in prisons and detention facilities, and evidenced by this conversation just how egregious some of these conditions are, and really violating the human rights of these Gazan detainees. If you want to read more, you can check out our full report about the detention facility and the ethical issues that have been reported at Stay Teiman. And if you have any questions or comments, you can always email us at mail@phr.org.il. Thank you very much for listening to this episode of Diagnosing the Barriers, and we will see you next time.